Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And tonight we're going to talk about public health. And I have two guests. My friend Helen Eddy, who's the director of Polk County Public Health. And we also have with us Carrie Levita Townsend. And Carrie is the supervisor over the disease prevention division of Polk County Public Health. So welcome.
Well, thank you.
I would have to say that myself included, before I got to know you, didn't have a real good feel for what public health does, especially how it intersects with various diseases. I think I've always thought of it as a place you would go if you needed to get shots if you're going to travel overseas.
Well, we do a lot of that, but that's not the only thing that we do.
Before we talk about public health, though, let's get to know you. So, Helen, where are you from originally, like grade school, high school days?
I am from Indianola, Iowa, so I am a Central Iowa girl, Central Iowa native.
And what was your claim to fame in Indianola High School?
Probably that I had a vintage giant popcorn popper that had come from our family's movie theater. So I always supplied all of the popcorn for all of the school events. And by the way, it's still in my basement.
You still have it.
And it works.
Oh, okay. Well, we know where we're going to have
So I'll bring treats next time.
Okay.
Sorry.
Okay. And then when you graduated from Indianola, what was next in terms of education?
I graduated from Indianola High School. Then I went to the University of Iowa, and my original intention was to be a physician, but a parasitology class my sophomore year kind of took care of that. So I ended up going to pharmacy school at Iowa.
Oh,
so
really?
I graduated with a degree in pharmacy from the University of Iowa.
And what was your first job after you graduated in pharmacy?
Well, that wasn't enough school for me.
Oh,
So
okay.
I turned around right after pharmacy school and went to Drake University and got my master's in business. But while I did that, I worked for Hammer Pharmacy, what is now down in the East Village. It wasn't so hip and cool when I was working down there, but that's where I started my pharmacy career. And then I sold pharmaceuticals for Eli Lilly for about 3 years.
And then when did you get into public health?
Well, that was after 30 years at Hy-Vee. So I did pharmacy, pharmaceutical sales, and then I went to Hy-Vee for 30 years as a pharmacist, and then in corporate pharmacy management, health and wellness, which is where our paths first crossed. And then 7 years ago, I retired from Hy-Vee, but I left part of my heart in public health through some of my activities at Hy-Vee. And I had the opportunity to go to work for Polk County.
Wow. Yes, you and I first met with the Iowa Healthy Estate as that was
Yes.
getting initiated, and Hy-Vee had a big role to play in that, and they
Yes.
sort of loaned you
They did.
to the Healthy Estate.
That was an interesting time because we kicked off that initiative and then we really needed to form an organization to go behind it. So that was my role, and Hy-Vee loaned me out, and people at Hy-Vee thought I worked for the governor, but I had an office at Hy-Vee. It was kind of odd, but that was my introduction to
Yes,
public
I
health.
wasn't ever, I knew you were a bicyclist. That was part of the connection as well.
Yes.
Well, thanks for telling us about yourself. And Carrie, let's get to know you. Where did you go to high school?
Well, I was born and grew up in Cedar Falls, Iowa. So I went to Northern University High School, which usually throws people.
Wow. So you and I kind of had a high
They had
school.
a lab school. It started,
okay.
it was K through
How
12.
many in your high
My
school
graduating
class?
class? 57.
57.
Mhm.
And what was your claim to fame at University High School in Cedar Falls?
Honestly, I was the statistician for the men's and women's basketball teams.
All right.
So I loved data even back then.
So yesterday I met the new NCI director, the National Cancer Institute director. Her name is Kimran Rathwell. And she is from Cedar Falls and went to UNI. So she was born in about 1953, and she is the first NCI director from Iowa.
Well, very good for her.
So, and then what did you do when you graduated from high school?
I went to the University of Iowa and I was a pre-med track. I worked in the pathology lab at the University of Iowa Hospitals and Clinics, and that very quickly kind of steered me in more of
Away from medicine and into
public
something
health. Yeah.
into public health.
Public health. Yeah.
Okay. Well, welcome. So, how about Helen, you tell us what would be a good definition of public health? And then specifically as it relates to a county public health department.
Well, I would say probably the reason that a lot of people don't really understand what public health is or does is that when we're doing our job really well, it's kind of behind the scenes. It's pretty silent because we always have a prevention approach to everything that we do. But you can go out online and look at what are 10 essential public health functions. And it includes emergency preparedness, as you saw during the COVID-19 pandemic. It includes building relationships across the community. Those are some of the functions that we have. It includes immunizations. It really takes a look at evaluating the data. We're in the middle of a community health needs assessment right now that we are doing in collaboration with Mercy One and other health partners. And we're always looking for what are the trends, what are the needs, where can we take a lead, or where do we need to support? Because public health can have an angle on almost anything, but it's really kind of teasing out what is most important in your community. But all the work that we do is with a prevention approach. How do we prevent downstream effects for people? So we're always looking, the phrase upstream,
Yeah.
to look. And I say that public health officials, we're kind of like annoying 3-year-olds because we always say, but why, but why, but why, but why, until we get to a root cause maybe of something that we see.
Somebody used an analogy, and you probably use this in public health all the time, but it makes sense. Like you're standing by a river and there's babies coming down, and you're just trying to get the babies out of the river, And public health is, why doesn't somebody go up the river and see why there are babies falling into the river?
That's a good example, and that's what public health does.
Okay. Well, good. And Carrie, your role is specifically in disease prevention, and maybe give us a little bit of a understanding of how you prevent disease. I mean, I think of immunization as one way of preventing disease in terms of infectious disease. In the world of cancer as a major health problems, how does the public health department with prevention of disease interact with preventing cancer?
So a lot of what we do is education, creating awareness, helping people to know what kinds of things they need to do to prevent, like getting screened, knowing they're normal. So when they recognize a change, they are communicating with their provider so they can get that checked out, and early detection if it is cancer. Talking about things like, healthy diet, moving, being active, all of those behaviors that we can engage in to be healthier.
We call them modifiable risk factors, which account for about 45% of cancers in the United States. Things like smoking and obesity and what you eat and alcohol and infectious diseases.
Yeah, and we talk about knowing your family history.
Right.
And what does that mean to you, and talking to your provider about your family history. Should you be screened more frequently? Are there some other things that you can do based on what you know about your family history?
With your public health thinking hat on, why? What do you think of when you hear Iowa has the second highest incidence of cancer in the United States, only behind Kentucky, and it's the only state with a rapidly rising incidence in cancer? So what do you think of in the public health framework of thinking about that as a problem?
My very first thought is we have a lot of work to do. We've got to try to drill down to some of the root causes and be working with our partners and getting information out to individuals and families. And
what does drilling down to the root causes look like?
Well, that's going to involve, like I said, a lot of our partners in terms of what the experts...
Probably an investment in research.
Research is certainly a component. And, taking a look at different factors and, that influence, and it varies from cancer to cancer. Looking at a combination of environment and genetics and family history and age and lifestyle, all of those things that come into play. And a lot of that does involve research to give us some answers, to make
Mhm.
some decisions about how we can then provide programs and services that can make a difference.
And Helen, what do you think about when you hear that we're second in the
Yeah.
nation in terms of the incidence of cancer?
Well, I think we have to look at some of the driving factors out there. And Iowa HHS has published really kind of their health analysis and their health plan. And I brought some of the factors that they look at. And this is going to be a priority, I think, for the state as we move forward. But they identify things such as our binge drinking rate, our obesity rate, our lack of movement in our community. On a very specific cancer in terms of prevention, we have work that we can do to improve our HPV vaccination rates. And so those are some of the factors that we look at, and they're starting to track. And that data is available. You can go out to Iowa HHS website and pull it down, and you can pull down county snapshots. I brought the Polk County snapshot, and it talks about what's going on right here in Polk County. And so that helps maybe inform some of the work that we do and the programs that we may offer to the community.
When I look at Iowa compared to the states around us, there's two things that seem to me, and again, I'm not a PhD and not a researcher. This is just kind of more of a common sense approach. It seems from what I know, there's two things that kind of make us stand out. One is we've got one of the highest radon concentrations below Iowa, certainly higher than surrounding states. And although we know that radon is linked to lung cancer, as someone who studied radiation biology as part of my radiation oncology training, it seems to me that it's possible that it may be contributing to some of the other cancers. But it's, again, this hard to just get the data for how many cancers we think are caused by radon. The other, which is even harder to get data on, you look at the number of pounds of ag chemicals per square mile in Iowa, because we have such wonderful fertile land and so many acres of crops, the number of ag chemicals, and then also when you throw in chemical fertilizers, but then also manure type fertilizers, that it seems to me that probably is a contributing factor. But it's, you can go online and see how many cancers do we think are caused by cigarette smoking in Iowa, but there's no place to go online and say how many cancers in Iowa do we think are caused by ag chemicals.
I agree. I mean, sometimes that data is not out there, and common sense, like you said, tells us that there may be some linkage to that. And I think we have to examine that, and I think we need to advocate for that as a community. And when I work with communities and people, sometimes those things feel big and things that we can't touch and we can affect. And sometimes we like to focus in on how we can help individuals take action. So that's why you see us talking about, how do you stop smoking? How can we be more active? How can we improve a diet? What can we do about binge drinking? What can we do in terms of screening for cancers and making sure that we're getting access to people to those tests and those programs? So, it's a big issue. I agree with you. I think those things are probably likely contributing factors, and public health continues to try to have a voice at those tables to say we need to look at this more closely.
Yeah, and I'm certainly not trying to throw agriculture under
No.
the bus, because the advances in agriculture, which includes hybrids and chemicals, have made us just very good at producing a lot of crops that contribute to our food. Well, some to gasoline too, but we're there's many benefits that come from it, but it's appropriate to look at perhaps some of the risks that we are experiencing because of it.
Absolutely.
When you brought with you the Iowa HHS recommendation, was there anything surprising when you look at the Iowa HHS as it relates to cancer?
Not surprising. I think, as much as anything, tells us we have work to do
Mhm.
and continued work to do. I mean, I look at Polk County and it says that, our incidence for cancer is 476.4 in Polk County versus 486.8. It's not like we're tremendously better in Polk County. Is that really even statistically significant?
Mhm.
So there's work to do. There's work to do. That's what I see.
I was just in Washington, D.C., lobbying with the American Cancer Society, and one of our asks of all of our representatives and senators was to increase the funding for the National Institutes of Health, National Cancer Institute, and CDC. A lot of people think of CDC as infectious disease, but as you know, CDC has a division of cancer control and is a major funder for breast and cervical cancer early detection, specifically for women that are uninsured or underinsured. Maybe tell us a little bit more about that program, the breast and cervical cancer early detection program, and how that comes through the state and to Polk County, and how Polk County approaches finding women who may be in need of screening for breast and cervical cancer.
That's a perfect segue. I'm going to turn it to Carrie because she manages that program for our county. And this is some work that before she starts, I'm going to say extremely proud of, because we really have a mission at Polk County to reach out to our underserved women in this community women and men that may not have access to resources that people with insurance have. And Carrie leads the team that manages this program. And I'm amazed every day at how they know how to navigate through the system to connect individuals to the resources they need at the exact right point to get them the maximum coverage so that they can get the care that they need. So Carrie.
Okay,
You take it away.
You're on point here.
Okay, so Care for Yourself is the national program. And so that money comes down to the state, and then the state partners
Gotcha.
with local
Is Care
public
for
health.
Yourself the name at the national, or that's the state name?
It's actually Care for Yourself carries through.
Okay.
And so
And that's just
it gets
an
technical.
easier
It's a
name
breast
than-
and cervical, early detection and prevention program.
Mhm.
So that gets long. And so we kind of
Call it Care for
call
Yourself.
it Care for Yourself.
And so
as
the
those
money
dollars
comes
come
from the
down to the-
CDC to
the
the
state.
Iowa Department of Health and Human
Health-
Services
mhm.
now.
Correct.
And then do you, as Polk County, have to apply for grants to get some of that money to come to Polk County?
We do write
Okay.
a grant annually to get that funding and to be able to administer a program. As Polk County, we serve 9 counties.
Oh,
and
you're not just Polk County.
We aren't just Polk County for breast and cervical cancer.
Okay,
No,
for that program, you oversee that program for 9 counties.
for 9 counties.
Okay.
And we coordinate with the other local public healths throughout the state, to make sure that there's full coverage over the state so that all Iowans have an opportunity to participate and know about this program.
And what's the process for women who are uninsured or underinsured to find out that this program exists? Is it primarily a healthcare provider that connects them with you, or how does someone in need of those services find you and the program?
So in a lot of different ways. Some of it's word of mouth. We work with about 125 different healthcare providers and radiology facilities. We have agreements. So, a woman can go today for her mammo appointment, and maybe she just lost her job and she lost her health insurance. And instead of saying, we may need to reschedule you, they can contact us. We can enroll her on the spot. She can go forward, get that mammogram, and get that mammogram covered through our program.
Okay.
So we have providers that enroll and just dovetail with us to get authorization to see them. We have people who walk into our offices and want to sign up, call on the phone, tell their friend, bring their friend in. So lots of different ways that we try to get the word out.
So about 10 years ago, when the Affordable Care Act became the law of the land, we had a huge increase in patients being able to have insurance. Over the last few years, even those government health insurance programs that you buy through the exchange have gotten to be fairly expensive. And through some of the COVID work, there was put into effect some tax credits that actually allowed those individuals who are getting their health insurance through healthcare.gov to have tax credits, which in the last 3 years has increased the enrollment by 5 million people. The reason I know this is one of the things we were lobbying for is those tax credits are going to go away. And some individuals, just the cost of insurance, even through healthcare.gov, is so expensive that they end up going bare because they can't afford the premiums. And there you end up with more women that are in that category of uninsured or underinsured. Have you seen a change over the past 5 years of the number of women that you serve through that program? Either changes that might be COVID related or changes that might be related to the tax credits that got more women the ability to have affordable health care insurance?
Initially, when ACA came to be, we saw a lot of women getting enrolled and had very, very high deductibles. So they might have a $300 a month premium and a $10,000 or $12,000 deductible. And so basically, a lot of it, their care was coming out of pocket. So they would be considered underinsured and they could enroll and receive services through our program.
But correct me if I'm wrong, the screening mammogram couldn't go to copays and deductibles, right? Part of the Affordable Care Act was that it covered prevention and early detection without copays and deductibles.
That is true, although we saw some changes in how preventative mammograms were identified and considered. So there might be a time where we would cover an initial mammogram and then their health insurance would, pick up from there. Or they covered the initial mammogram, but not the diagnostic mammograms they need once that initial mammogram comes back abnormal. So again, we could dovetail in there and cover that diagnostic imaging and let their insurance carry on from there.
One of the things that has always been a bit confusing is I know that program is basically about early detection and screening. But when it comes to the cost of early detection and screening, that is kind of minuscule compared to the cost of treating a cancer. How can you help someone once they're diagnosed with cancer? Does the funding for actual treatment of cancer come from that program, or do you have to then bring in other programs when it comes to helping individuals that are uninsured or underinsured actually pay for cancer treatment?
So yes and yes. So in essence, initially when they come in, we can cover the office visit, we can cover the PAP and the HPV test and the mammogram. And then if we have some abnormal results and they need to go on and have some diagnostic imaging or tests, there are tests that we can cover, some we need to get pre-authorization for. If they ultimately end up diagnosed with breast or cervical cancer, one thing is there is the BCCT, or a special Medicaid that covers for the duration of cancer treatment. And so that's something, if you are screened through a nonprofit, like a program like Care for Yourself or with Bras for the Cause dollars, or at a Mammos and Muffins at a radiology facility that's funded by local funding, that makes you eligible for BCCT. So we can even help enroll someone in BCCT that didn't actually come through our program, but was screened through a nonprofit
And if
effort.
I understand that is a part of Iowa Medicaid.
It is
correct?
part of Medicaid, yes.
Okay.
And then that would cover them for the duration of the treatment.
Okay.
Also, where that's not maybe an option, or there are other things that come into play, our staff are very knowledgeable of the financial assistance that's available in the community, of the marketplace. And so they just work tirelessly with our community partners and at the marketplace to find the right fit for each individual to get the coverage that they're going to need.
I know one thing that is kind of sensitive and just totally heartbreaking, and I don't know that we have a one path fits all, but it's someone who is, and I'm not even sure the right word we're supposed to use, but is an immigrant and undocumented and here without, papers, or they may not qualify for some of the government programs. Is that correct?
Correct. And there are people that are here very much legally, but there may be a 5-year bar. They have to be here 5 years before they can qualify
Thank
for
you
services.
for correcting that they're here legally, but not in a way that they're able to get the public
Access,
services.
right.
And so then do you have connections with not-for-profits in the community that may have as part of their mission to help women like that?
There's financial assistance that, there's a variety of different options that, again, staff are really knowledgeable of, and what the eligibility criteria are and aren't, and what would be the best fit. And sometimes it's, there's also like a really low, $10 a week payment plan that they may be working through, as they go forward.
So when I think of all of this, I'm thinking of, what do you have for personnel? Like, how many social workers do you employ? And do you have like homegrown talent? I know you don't necessarily have to have an RN or a social worker to figure out. But once you know how the programs work, you kind of are an expert on certain programs. What do you have for staff for these 9 counties to be able to connect uninsured and underinsured women with these services?
So we have a staff of 3. So we have a project coordinator who is a CMA and, lots of years of experience providing support and assistance. We have a health navigator who is really an expert on the marketplace and financial resources as well. And then we have a nurse case manager. So when someone enrolls in our program, they receive patient navigation. So they get a lot of education and support and reminders to make sure they get to those appointments. They have assistance, understanding, okay, this is an abnormal test result. What does this mean? What are the next steps? They talk about questions, and they'll get a notebook that they can take with their questions when they go see their provider. And then our nurse case manager follows everybody from abnormal screening all the way through any diagnostic testing, and if they're diagnosed, into treatment.
And do you partner with various refugee organizations or ethnic specific organizations? I can only imagine that, when it comes to language, even for individuals that are in a difficult situation or don't speak English, do you generally use a call line interpreter, or
Well,
do you use?
I'm very proud to say that all 3 of these staff that I just mentioned are bilingual in English and Spanish.
Okay.
So that's a
Wonderful.
wonderful
Yes.
benefit to our program. They also have access to language lines, so they can call and get an interpreter if they need to
the other
speak Vietnamese
languages
or Burmese or any other language. We also work with community organizations so that they understand our program and can carry messages and awareness to their community and their language group. So we do it in a lot of different ways to help reach people, translate materials into other languages as well.
Okay. Let's shift a little bit. One of the infectious diseases that causes 6 different types of cancers is HPV. And obviously, I think most people, although not everyone, knows that we have a vaccine for HPV that could, if fully utilized, help us prevent those 6 types of cancer. First, just a little factual question. So I show off a couple of facts that I still remember because they were recently put into my brain. What is the HPV vaccination rate in the state of Iowa or Polk County? I'll let you answer either of those.
The exact vaccination rate,
Well, not exact, a ballpark.
not where we want it to be. That's for certain.
So I'm thinking it's 40 to 50%.
Yeah, I was
Yeah,
going to
that's
say
about
about
right.
40.
Yeah. Do you know what the vaccination rate is in a country like Rwanda?
Probably
Yeah.
80.
95%.
Sure.
They just do it and make it part of it's not like, okay, it's time you could have your HPV vaccination. It's just like, okay, you're going to go to school and you're going to get it. So and obviously that's different public health approaches to
Yes.
carrots and sticks that get people to do what we think would be good, not only for them, but for the herd. So what role does Polk County Public Health play in urging, advocating, encouraging, mandating HPV vaccinations?
Oh, I'll start with this one. Carrie,
Okay.
you can fill in. First of all, HPV vaccination has gotten a bad rap and it has a stigma. It's like it's the sex vaccine. It's not, and it gets labeled that way. And so we get some pushback from parents. We get pushback like, my child isn't sexually active. No, but they will be some point in their life. And it also prevents cancer. So we're trying to reposition the branding of it and turn it from being it's related to sex and sexual activity to it's a
the
cancer
prevention vaccine.
Prevention vaccine.
And
And
the
An
optimal age
effective-
to do it is age 11.
yes. So we work with providers. One of the best practices out there for vaccinations, and it's one we practice at the Polk County Health Department, is that when you come to the Polk County Health Department for vaccinations, we will vaccinate you and catch you up per ACIP guidelines. Those are the guidelines that come through CDC and the American Council for Immunization Practices. And they say, this is what you're supposed to have at what age. So when you come to the health department, there's no picking and choosing. We say, this is what you're supposed to have. We're going to catch you up. So if it's an individual who comes through the Polk County Health Department, they receive that vaccine. And that is a best practice that is recommended by CDC.
Gotcha. And did you become like a vaccine machine during COVID?
Oh, heck yeah.
And I mean, it's amazing how, and I'm going to encourage you to tell us the story for Polk County Health, but the way pharmacies have become vaccine machines. I mean, I'm a doctor in a health system and I get my vaccines at a pharmacy.
So I have done that as well. I mean, part of my career at Hy-Vee was before pharmacists were giving vaccines was to initiate and train all of the pharmacists to be able to do that. And so when the COVID pandemic came along and we had a vaccine available, I thought, I didn't spend 30 years training 900 and some pharmacists at Hy-Vee how to do this without utilizing them. We wanted to rapidly deploy vaccine out and across our community, and it made more sense for people to get it at a pharmacy that is close to their home and that's convenient for them. We did offer them at the health department, and our focus, we took everyone, but again, our focus is always on underinsured and uninsured individuals. And so we did a lot of outreach to make sure that we were getting to those communities and making sure that they knew that we were a comfortable, safe place to come be vaccinated.
And I'm going to ask a question, and not meaning it to be cynical, but with COVID, I would assume that you got funding for doing that as well. You were able to do it without a cost to the person getting the vaccine.
Absolutely.
But you were getting some federal funds.
There's
to do
federal
that
funds that paid for the vaccine. Vaccine was free, and they reimbursed us for the
time.
the
Did you have to
administration.
hire more people to
Oh yeah,
do all the vaccines?
we did.
Yeah.
We had a team of on-call nurses that we paid to come in and do it, but we also had a very strong partnership with Des Moines University and their fourth-year medical students. Think about what happened. COVID pandemic happens and their clinical rotations are shot. They can't go out and do those things. So working with DMU, we had those students in the health department and they were immunizing. And particularly at the beginning of our immunization campaign, the relief that people felt, that hope that they felt from being able to get that first vaccination, those students would tell us that that was some of the most rewarding work that they had done. We had people crying and in tears because they could see that maybe we were moving forward.
So back to infectious diseases related to cancer. So in the United States, the infectious diseases that are they're related to the most cancers are HPV, hepatitis B and C, and H. pylori, a bacteria in the stomach. I don't think we have a vaccine for H. pylori.
No, we did not.
No.
Yeah. What about the hepatitis vaccinations? Is that something that you guys do with some frequency or?
Yeah, routinely.
Routinely. Okay.
Routinely, yes.
Okay.
We provide childhood immunizations, adult immunizations. We have a lot of, I say, new residents to our community that are coming in and need to be caught up on vaccinations as they're changing their immigration status. And so we do a lot of vaccination through those programs.
What are other ways in which Polk County Public Health interacts with individuals in a cancer-related way, either prevention, because we talked about modifiable risk factors that include obesity, lack of physical activity, nutrition, alcohol, sun exposure, vaccinations, radon. What are other ways in which the Polk County Public Health plays a role in cancer prevention and or roles that you play besides the ones we talked about in terms of either patients undergoing cancer treatment or that whole length of time we call cancer survivorship?
Well, you touched on radon, and we didn't really talk about one of the programs we have at the health department, which is our lead prevention and healthy homes program. That is funded some by the Polk County Board of Supervisors, but also by a HUD grant that allows us to go into homes of lower income individuals that qualify, that may have a child in the home that has either tested positive for lead or they want to have us come out and test, and we do, and we find that there's lead. There's a significant amount of housing stock in Polk County that is older than 1974 and can contain lead paint. But as a part of that, we also go in and do a healthy homes assessment, and that includes checking for radon. And so if the family qualifies and we find those risk factors there, then we have the funding to go in and physically improve that house.
Do the mitigation.
Do the
to lower
mitigation and the
radon.
repairs, yes. So we do that. And
Okay.
that's something we don't often talk about. We do a lot of outreach, but I'm not sure that the community knows that we do a lot of work around radon mitigation.
Yeah, I don't think the community knows a lot about the radon and the fact that I've heard as high as 75% of homes in Iowa are above the recommended level and could benefit from mitigation.
So we do that. We do a lot of outreach at community events. We get invited to a large number of community events, and we like to go out and do outreach to talk about our screening programs, cancer screening programs, and those programs that we bring. I do think that a gap, and I'd love to talk to Above and Beyond Cancer more about how we can partner for that post-treatment and survivor piece of it. I think there's a huge need in our community for people to understand how they can live well post that.
Yes, and I would say Above and Beyond Cancer is committed. We actually have a grant specifically to bring these services to traditionally underserved.
That's perfect.
Because as you know, social determinants of health, the barriers that sometimes there's just lots and lots of services for people who have the ability to get services in many different places and have their choice. But when it comes down to the services for those that are least able to get them on their own, it's even though they're free services, it's hard sometimes to make that connection in a meaningful way because there's so many other things that are going on in someone's life that is barely getting by, paycheck to paycheck, and childcare and transportation and
absolutely,
and services in the area that they live.
Yes, and I think we also have to always think too, as we're talking about cancer and cancer prevention. Carrie's team sees it day in and day out, but are some of the cultural barriers that we have in our community. We have individuals where talking about and seeing a physician and having someone see your breasts and do those screenings. It's a barrier. There's also a fear. You mentioned the financial piece of it, that they will put off treatment because they're afraid of what it's going to cost.
Mhm.
And often by the time we see them, then the cancer is much more progressed than it maybe would have needed to have been if they were
Right.
able to come to us earlier.
I see that for example, mammograms. The cost of a mammogram is really fairly low, and if you have any sort of ACA insurance, it's covered. But it's the fear that if you find cancer,
Yes.
that's going to be incredibly expensive, and so there's a bit of the head in the sand mentality about not so much as the cost of the mammogram; it's the fear of the cost of finding a cancer.
Mhm. Absolutely.
Um, what keeps you up at night as relates to public health in Polk County? Where do you think we have opportunities for improvement that could really change the lives of individuals in Polk County?
Well, one of the things I think that keeps every public health official up overnight is the next pandemic, because there will be one. We just don't know what it is. And we're constantly monitoring, looking at what's going on around the world. And what will be our community's capacity to want to do what we need to do to mitigate it. People are still tired. You talk about COVID-19 and eyes start rolling back in their heads, and me too. But we have to be prepared. And our community, in many ways, at least on the healthcare side, I think we're better prepared than we were going into the COVID-19 pandemic. We have tremendous cooperation through our medical coordination center that brought all of our health systems together. So that part of it doesn't keep me up at night, but other pieces of it do. Will our community respond to vaccines when they're available?
Mhm.
Public health mitigation strategies. Nobody likes masks, but they work. And if that's something we need to do, that will be what we're promoting. But some of the things where I think we have an opportunity, I see my friend Jackie in here, is really around safe storage of guns and gun safety. People don't often see that as a public health emergency, but we are working with the community and taking a public health approach. And I'm proud to say Mercy was one of the first organizations that stepped up and said, yes, we can do this. We're not demonizing guns. People say, in fact, I had a talk show host say to me, well, the public health department's getting involved in the gun conversation. What do you know about guns? I said, personally, not a lot. I don't own one. But what I do know is that they are killing our youth. And if I had something else in our community that was the leading cause of death for our youth, you would be expecting me to do something about it and my team to do something about it. So we're doing something about it, and we're talking about guns, and we're talking about safe storage, which says if you have people in your life that you care about, are you storing those firearms safely so they don't have access to those either for acts of violence or even suicides or accidental shootings? So that's one thing that keeps me up at night, and we had a bad weekend this weekend with shootings in our community.
That prompts me to ask, what is the role of Polk County Public Health when it comes to opioids or just street drugs in general, and or and I shouldn't say and or, a separate issue is what's the role that Polk County Health plays in the homeless population and the issues related there?
Well, we'll start with the opioids and opioid crisis. Public health, again, we are prevention-based. Harm reduction is a huge focus. And I think you heard today in the news that the death rate from opioid overdoses is going down nationally and is going down in Iowa. Everyone wants to take
Were
credit
you
for it.
surprised at that?
I'm surprised it's continuing down, but I think you're seeing a culmination of there's never one answer to a complicated issue. And I think it's the coming together of harm reduction with widespread distribution of naloxone.
Mhm.
It is talking about, I would love to get fentanyl test strips legalized in the state of Iowa. They're currently drug paraphernalia and illegal, but that allows someone to test what they have. A lot of our street drugs right now are contaminated with fentanyl, and studies show that if people are able to test those drugs and detect the presence of fentanyl, they may not use it all. They'll use differently, inject or smoke it versus injecting it. Injecting is much riskier. or they'll do it with someone there and hopefully they'll have the naloxone. So we have a lot of efforts underway to make sure that we have naloxone across our community. We work with partners, Iowa Harm Reduction. We have safe injection harm reduction lock boxes at Polk County and at River Place where people can get syringe cleaning kits to prevent hepatitis C and the transmission of HIV. So it's all of those things coming together. So I think what you're seeing is people are talking about it. People are aware. Naloxone's in schools. We're making it more widely available. It's a good thing.
Okay.
But ways to go.
And then the question about the homeless population and the role that Polk County Health plays in that problem.
Again, we work with the outreach teams that go out into the communities. We actually have a number of people that are unhoused that come to Polk County Health Department for STI testing and get our harm reduction kits and services. So we partner in with these organizations that have expertise in this. It's not something where we're the leading housing authority, but we recognize the role that safe and affordable housing has in the health in our community. And so we uplift and we support those efforts and have a voice at the table.
Well, I've got about 20 more questions, but I want to open it up to our audience. So we have a live studio audience here. They get first dibs at asking the questions. But if you are watching us live right now, please put your questions in the comments section. So we've got about 12 minutes for some questions. So I'll turn first to our live studio audience. And Boone, you're up first.
Okay. Dr. Denman mentioned the agriculture as one of the causes of, well, I shouldn't say causes of, or high rate of cancer in the state. Is there some research that Polk County is doing to find out if agriculture runoff has something to do with our high cancer rate?
I would say that is research that's actually being done at the academic institutions. The Iowa Cancer Consortium is housed at the University of Iowa, and I think they are the ones taking a look at that. We are at the Polk County Health Department not really equipped to do that level of research. So we rely on our academic partners across Iowa and the nation to do that.
What about something like nitrates in the water and the role that Waterworks plays with? I mean, do you monitor that, or how good they're doing, or is that not part of your
That
body
falls
of work?
that falls in environmental health, and the environmental health team in Polk County is at Polk County Public Works. So they
Okay.
handle air quality and water quality. Proud to say that with some of the work that is being done and funded by Polk County and Polk County Board of Supervisors around water quality, there's a portion of that Icon Water Trails work that is really focused on improving the water quality in Polk County, which makes sense. We want people to we're going to improve the recreation and being able to get into the water. There's also a whole separate team of experts, which I am not one of them, but I'm interested in it, that is doing the work on developing water quality monitoring metrics to be used in Polk County.
Okay. Other questions?
Yes, Dr.
Kevin?
Deming, this is for you. You were in Washington, and I don't imagine any of our legislative representatives closed the door on you. But were any of them ready to just grab the ball and run with something?
Yes, I would say that every single representative and senator have things that they're running with and that they believe is going to improve public health. I was there with the American Cancer Society, and we had specific asks that but then we would always conclude, I would always say, do you have something that you're working on? Because we're asking them to help us with 3 specific legislative asks. What are you working on as it relates to public health? So we were limiting it to public health related to cancer. So that's the role. So I would say cancer is a bipartisan issue. There is not a pro-cancer caucus and an anti-cancer caucus. Everyone is against cancer, regardless of political party and which house they're in. So some of the issues come to fiscal issues of, how much, what's the role of the government in spending money doing certain things. And assuming we don't have an infinite amount of money, it comes down to ordering priorities. Obviously, those of us who are there for advocating for cancer, including many cancer survivors and everyone who's lost someone to cancer, that's the issue we're talking about. But everyone is against cancer. Everyone is in favor of reducing the incidence of cancer and improving the cure rate and making sure that we have quality. But it does sometimes come down to how do you slice the pie in terms of funding of various programs. Do you have? I'm sure you have, as a public health, Polk County employee, can you do trips to Washington and
No.
meet? No, they don't like to do that. How about when you were at Hy-Vee?
Oh, yes, I do trips
You've
to
got
Washington.
So how would you answer that with the when you're there specifically about public health and you're meeting with senators and representatives? And
I think it's important. It's a lot of education. I don't know what your experience was like, but oftentimes we would not even get to meet with our actual representative. We would meet with their staff. And so a lot of it was educating their staff about the issues and things that were maybe important. And if you're lucky, maybe some of it, I always say maybe some of it sticks.
mm-hmm.
Yeah.
It's not a one and done. It's constant education. And one of the big priorities is the funding of NIH, NCI, CDC. That happens every year. And the whole sausage making process around appropriations is they can sort of say they support us, but when it comes down to the way that the budget gets written and has to then have a continuing resolution at the end of the year before we close things down, sometimes they don't have the individuals, if they're not on the appropriation committee, don't have a lot of say about what the exact funding of the NCI is going to be.
I would say in terms of public health funding, if there was one wish that was out there across kind of public health as a profession, is that we kind of live in a feast or famine kind of cycle. In other words, money floods in when there's a pandemic, it goes away, and then we're left with 3 people trying to navigate 9 counties through cancer prevention. And so if we could have more consistent funding of some level, we do a lot of great things and try to work some miracles with the money that we have. And we're masters of braiding funding and sources that we have. But as a public health professional, that would be my ask, is that if we could have some more consistent funding to be able to reach people and do the work that we need to do.
Other questions?
Hi.
Yes,
Well,
Angelina.
I'd like to plug in. I'm a retired preschool teacher. So going with the school year, I always go for the flu shot. So I always went to the doctor and the nurse, but when the doctor didn't have that nurse, I was like panicking. My friends are going, just go to Hy-Vee. They're great. And I have to admit, because I'm terrified of needles, you guys do a great job. Because I remember one pharmacist, I go, just let me know when you're done. He goes, I already did it. I went, oh, you're good. So I
to hear
totally
that.
recommend it to get your shots at Hy-Vee. So just want to plug that in.
Yeah, pharmacists were huge partners. And I still have a lot of my heart at Hy-Vee, but I also want to give a shout out to our other community pharmacy partners. Medicap pharmacies were tremendous partners, as were Walgreens and CVS. And we could not, our vaccination rates for COVID in Polk County were higher than the states. I mean, our community and our partners got out there and got it done. And so get your booster this fall, please.
Yeah.
Yeah.
I got my booster for COVID and my flu both on the same
Very
day
You can
good.
do it
from a
same time.
pharmacist. Yes.
We like that.
Yes, George.
I got a question from a viewer on Facebook. Beth wants to know, do all counties offer the same benefits? What about if you're 2 hours away from Des Moines? She's not a cancer victim herself, but she has a friend that is, and the friend's in Harlan, Iowa.
Carrie, I'll let you answer that.
So there are public health departments throughout the state that provide the same care for yourself services that we do. So if somebody, even if they call us, we're going to get them connected to a program or a service or a community partner that can help in their area.
Carrie, follow up on that question. I've had folks from the state that manage the care for yourself at the state. Can people go directly to them? Is the proper
To the
channel
state.
to the individuals that are doing the care for yourself program in the Iowa Department of Public Health?
Certainly, there's a phone number on the website that that someone could call, and then they're going to connect them with their local program.
Gotcha. So if you go there, they're going to connect you
Mhm.
to you guys.
Yep.
Okay.
And we have the ability to serve someone, anywhere in Iowa. We want to try to connect them with their local program
Mhm.
first. But if it means they might not be able to get screening services, we're going to help them get that done.
Thanks.
And we've got a viewer on YouTube. Mary says she thinks she knows why we may enjoy the dubious distinction of leaders in new incidents of cancer in this state. And it is because 200 pounds of manure particulate are emitted each day by confined animal feeding operations, CAFOs. 200 pounds of particulate a day of manure, which is unique to Iowa, obviously. So I guess that she wants to know whether or not you have a reaction to that.
I can't react to that. I don't have the research or the numbers in front of me to react to that. Carrie?
I think that speaks to what Dr. Deming was talking
Yeah.
about in terms of agriculture and being a factor.
So Mary, you're in luck. In the next month, there are 3 conferences that are being held. They're all being held at Drake campus at the Olmsted Center. One is the Harkin Institute is doing a whole day on animal confinement and the issues related to that. And that is next week. I don't have the date and time, but look for that. To go to the Harkin Institute website, and you'll find there's going to be a whole day looking at animal confinement operations and the role that they may be playing in public health. And then the Iowa Environmental Council is also doing their annual conference in the next month. This happens to be, they're going to be using the Drake facility. And then third is the Nature Summit, which is at Drake. Neil Hamilton, who is an ag law specialist, retired from Drake Law School. The Nature Summit will also be dealing with issues related to ag chemicals, confinement, the environment in general. So those are 3 great conferences that you could attend to learn more. And you'd also, at those conferences, be meeting with some of the individuals that are doing the critical research to try to connect the dots between what could be a problem and how to do how to know what we know now and how to conduct research that might answer the question. And I think, George, that's going to be the last question right now. And thank you so much, Helen and Carrie
Thank
from
you for
the
having us.
Polk
Yes.
County Health Department for being our guest. If someone knows someone else who would benefit by watching this program is going to be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel, Above and Beyond Cancer Facebook, and the Mercy One Cancer Center website. I hope you'll join us again next week for our cancer education series. Thanks, everyone.